I want to introduce Dr. George Bohmfalk. He is a Texas native, grew up there, studied there, and practiced neurosurgery in Texas for his career. A very successful career in neurosurgery. But he did retire. And after retiring, he and his wife moved to Charlotte to be closer to the grandchildren. And about 4 years ago, he became enlightened about Medicare for all. And he went to a presentation, a healthcare justice presentation similar to this one. And he's become involved with the National Parent Organization, PNHP, as well as the local chapter. So George is going to give you an update of activity. George?
Well, Dr. Sachs showed us the problem, right? The impact on the minority communities from the AIDS epidemic, from the COVID pandemic is unconscionable, as was that one as well. So the question is how we get to a solution. And you know, perhaps the pandemic may be a little bit of a turning point in how we do healthcare in the United States. So I'm going to spend just about 10 minutes briefly reviewing what we think is a solution and talking about the obstacles that we may confront and some strategies that we can all work together on to try to kind of get us there. So most of you who are involved in our group in this call are familiar with Medicare for All as the gold standard. But I'll review in just a few seconds as a little bit of a reminder what Medicare for All essentially consists of. So the bottom line is we're spending twice as much per person, twice as much as other countries per capita. We're spending around $3.5 trillion per year, and we have worse outcomes in terms of infant and maternal mortality, life expectancy, and the particularly glaring thing about this is the racial inequities that Dr. Sachs just described. Of this $3.5 trillion, it's absolutely astounding that over a third, 34% of it is on paperwork, administrative overhead. And that's where we think we can make the most difference. Everybody always talks about, oh, there's too much waste, unnecessary care, and high prices and things like that. But the low-hanging fruit here is the administrative overhead. We think we could probably save around over half of that, over $500 billion a year. And that's much more than is needed to take Medicare as it currently is and expand it and improve it. We would expand it to be comprehensive and universal, which means everyone is covered. And it would be expanded also to eliminate this gap. A lot of seniors have Medigap healthcare insurance because Medicare only pays 80%. Well, Medicare for All would get rid of that. It would pay for everything. And it would eliminate all these other programs like Medicaid and children's health insurance. So it would essentially simplify our healthcare system by wrapping everything into one program. So the money we would save is more than enough to do that. And we're comfortable from any number of economists who've done projection on this that Medicare for All will reduce overall national healthcare spending. So we pay less and we get more. And the thing to keep in mind is that this is not a government takeover of medicine, it's just government financing. So when you hear people talk about, oh, I don't want government running my healthcare, well, most of you are familiar with Medicare right now. All the government does is pay the bills. And so you would still have private delivery with free choice of physician and hospitals. So that in a nutshell is what Medicare for All might be. Go to the next slide and we'll see, click it one more time. Yeah, that it's estimated that 95% of households will end up paying less for much better health care. It would be full coverage, everyone would have it. And the next slide shows just kind of a graphic that if you take all the money in that stack on the left, that's what you're paying for insurance premiums, deductibles, subscriptions, dental care, all of these things would be wrapped in a Medicare for All. You'll pay less for it and have full coverage. So the best analogy, to my mind, is like how we finance fire departments. Fire departments historically used to be private for-profit businesses, and society found out that didn't work out too well because if your house wasn't insured, it burned down all the houses on the street. And so the country found out that for the common benefit of all, it would be better to have publicly financed fire departments. And that's exactly what I think we need to do about healthcare. So let's look for a minute at why we're not there yet. There's a whole lot of reasons that people resist Medicare for all. People don't like major change in general, right? And there's a lot of fear of the unknown. One of the biggest things you'll hear is people say, well, how are we going to pay for it? And oftentimes that's just kind of a dog whistle. That's kind of one of these little excuses for saying, I really don't want it for any number of other ideological reasons. So they'll raise how to pay for it. The bottom line is we can pay for it. As we just showed, we can pay less. The how to pay for it, we have all manner of details. Of course, until there's an actual bill in Congress that goes into that, we can't tell you the details, but it's a fairly simple matter of straightforward payroll taxes and some other progressive taxes. The money is there and everyone will be better off. So another point of resistance is ideological. And a lot of folks just don't like the idea of paying for others' things. And what we're finding, particularly in this era of greater heightened awareness that Dr. Sachs just pointed out about racism all around us, is that when people say they don't want to pay for other people's stuff, they generally mean minorities and people of color. And it's no surprise if you look at the 12 remaining states that have not expanded Medicaid, 8 of them are down here in the South. So I think that suggests kind of what's the underlying kind of motive for resisting Medicaid expansion. It tends to overlay the Confederacy. So I think that has to be addressed. Another ideological point of resistance is this thing about fear of big government. And everybody said, oh, we need to keep the government small. And everybody talks about how Reagan, had all this stuff about we need smaller government and big government's terrible. Well, the pandemic has pretty well showed us, I think, that a little more government, a little more effective and maybe a little larger government in this past year probably would have been a good thing. It probably would have saved tens of thousands of lives. It would have had a smoother rollout of the vaccinations. We wouldn't have had governors and mayors fighting each other with this PPE competition. So the fear of government, I think, is another smokescreen that people just say is an ideological defense against doing something that would end up helping the rich and the poor, all of us together. And then lastly, I think there's a million reasons people resist it, but on a big scale is the personal financial hit that some people will take. Obviously, the huge pharmaceutical companies are going to lose some money. They're not going to go broke. They're not going to go bankrupt. Instead of making $12 billion a year, a quarter, or whatever, they might make $1 billion. They'll still stay in business and still have stockholders. The private health insurance companies, this is existential for them. They will essentially probably go away. But the concerns about how that would wreck the economy are misplaced. It turns out that the number of jobs in private insurance that would be lost if we had single payer Medicare for all equals the same number of people who are fired in the United States every month. It's not a huge, insurmountable number, and provisions are made in all these bills for taking care of these people whose jobs would be lost in a transition. Obviously, some higher paid physicians resist the notion of Medicare for all, but there's a whole lot of physicians who are not paid so well. And what I see is that the income disparities among physicians will be narrowed. That primary care physicians would probably make more, and high paid specialists like neurosurgeons, orthopedic surgeons, and others might get a little bit of a 5 or 10% pay cut, but I imagine they could still manage quite well in taking care of their families. So where do we stand right now with Medicare for all? We have a united Democratic government, and it's like, well, great, well, we could just kind of sail this right on through. Well, you've already heard enough things about how fragile this majority is that nothing is certain. And I'm sure you're all aware that in his campaign, Biden came out and said he would basically veto a Medicare for all bill if it came to his desk. So he is not our enthusiastic supporter. And some people have said that he's reluctant to do anything for the first 2 years here that might risk losing any more seats in the midterm elections. So, it's a little bit difficult in terms of what Biden might be willing to do. Now, I'm encouraged because the person who is on the verge of being approved as the Health and Human Services Secretary, Becerra, was in the House of Representatives for a number of years before he became Attorney General in California. And in the House, he was a co-sponsor of the previous iterations of the Medicare for All bills. So I believe in his heart, he believes in it. So to the extent that he might be able to illuminate and influence Biden, time will tell. But Biden has to be very careful about maintaining the Democratic majority in the midterms, and so I think that flavors kind of what he's willing to do or not do. What we've heard talk about is a bunch of these incremental steps, maybe doing something to negotiate prescription drug prices, some other slight little tweaks on the Affordable Care Act. Of course, he's heavily invested in that because he helped Obama get it through. So the bottom line is people ask, well, what's Biden's plan? We don't have a detailed plan from him yet. He's dealing with the COVID crisis and other things kind of first. But we will see and we will hear. One thing that you'll probably hear him talk about, because he has in the campaign trail, is the notion of a public option. And the public option is a beast that can be good or bad. We're very concerned about public options that can be taken advantage of by for-profit insurers in competition with it, that it won't be a level playing field, and it'll basically end up being the insurance of last resort for older, very sick patients who require a lot of expensive medical care. That would be bad. So if you start hearing about a public option, tune yourself to listen for whether it's a government plan and not a plan maintained by the private for-profit insurance companies like Medicare Advantage. It has to be a government plan. And the other thing is, ideally, it would have automatic enrollment, so that when babies are born or when people lose their jobs or something like that, they automatically go onto this public plan, so that we get kind of a pathway to growth in the risk pool and the numbers in it, so that it might be better able to survive. And the other thing that you're going to hear about is some representatives in Congress like the idea of state level single player plans. We have concerns about those. None of them have worked yet. Vermont, California, a bunch of states have tried them. There's a whole lot of reasons why we don't think they'll work. But a lot of people feel very strongly that the states should be the laboratory for the country, and we ought to start out in the states. I think that's a doomed notion, but you'll probably hear about it, and who knows what we might learn from it. But keep in mind that we have a lot of support for Medicare for All, and the more recent polls show that overall, over 70% of the population supports Medicare for All. Here you see the change from 2013 to 2018, and look how it's skyrocketed there. And among Democrats, huge interest in this. I mean, this is as broad-based support as you have for the Biden, bailout for the COVID relief plans and things like that. The public really wants Medicare for All, even though they don't understand all the details of it. And look, even in Republicans, they are bouncing around 50%. And physicians, the majority of physicians support Medicare for All. So we have sentiment on our side. So how to proceed? Heretofore, I think you have heard us talking over the years about the economic and the rationale from health outcomes about Medicare for All. We're wasting money, and it just makes common sense to do this and help everyone. But the healthcare inequities laid bare by the pandemic present an opportunity to make a more compelling moral argument. I'm just talking about numbers. James Baldwin, a number of years ago in the civil rights era, said we don't need numbers, we need passion. And that's what I'm beginning to see about this Medicare for All thing. If we could talk numbers all day, and the other side is going to talk back to us with their numbers, we're not going to make any progress. But if we could approach this as an opportunity to create a new healthcare system to deal with the structural racism and its health impact on minorities, that might allow us to frame Medicare for All as a moral issue of social justice and anti-racism. And that may turn out to be a better, more effective route to a greater acceptance of providing better healthcare for all of us than has so far, just spouting off all the numbers and showing all the charts. So in terms of strategies to end, I think one of the most important things we need to focus on is making this movement multiracial. There's been some talk that the Hispanic and Latinx community really kind of hadn't been that involved in our advocacy, and the Black community similar. we haven't really created a multiracial front to advance Medicare for all. And I think that needs to be done. In terms of a national strategy, the Medicare for all bills are going to be reintroduced in both houses of Congress probably around the end of this month. I communicated with Representative Jayapal's office this morning. They say they currently have, I think, 69 initial co-sponsors. They want a whole lot more. So all of us can contact Representative's office. I wish I had tonight a list to provide you of specific offices to contact. That's still being worked on, but we'll get it out and put it on our website and in our newsletter as soon as we get that. But we need more co-sponsors because that sends a message to the rest of the Congress that this is something that the whole Congress is behind. And we need to urge these representatives to get the committee hearings on. In terms of state level strategies, expand Medicaid. I mean, that is not an end result. That's a interim step before we get to Medicare for all to relieve a whole lot of suffering in the state. And, you know, Representative or Speaker Moore made this thing in his opening speech about he wants this session of the legislature to be one of justice for all North Carolinians. Well, write him a note there at that address and email him and kind of say, let's have a little justice. Let's expand Medicaid. Locally, there's some effort to get resolutions by the county commission and the city commission to issue resolutions. Durham and San Francisco and a lot of cities have done this, and that tells upper levels of government that there's broad-based support for that. So if you hear any talk about resolutions, please lend your voices, communicate with your representatives, and support and encourage them to vote for these resolutions. And then obviously keep this in the public's mind. Talk to your friends, write letters to the editor. We just like we haven't talked about racism much in this country, we haven't talked much among ourselves, friends and family, about Medicare for all. So raise that as a topic. Ask people what they think about it, what their solutions would be, and see if we can get more people on board with Medicare for all. And then, as I suggested, frame this as a moral anti-racism argument. I think that just has to be a way forward in this. To look at the Gettysburg Address, I was struck that we could say we should resolve that these dead, disproportionately minority dead now, should not have died in vain. So I think with all these things, we'll keep plugging forward and hopefully advance the case for Medicare for all. So thanks very much.